Irregular periods, a hidden growth in your uterus could be the culprit. Known medically as a polyp, occasionally this intruder stays silent and can affect women from their 20s to their 80s. Quite surprising, isn't it? What exactly is a uterine polyp? Think of it as a tiny skin tag or grape-sized growth inside the uterus. Most polyps form from the inner lining of the uterus, known as the endometrium, which is why they are often called endometrial polyps. Uterus has two linings. The inside one gets shed every month till menopause and then regrow from outside layer over next month. It is a cycle known as menstrual cycle. The outside lining or the wall is from muscle called myometrium. This layer is permanent. Most uterine polyps arise as a growth from soft endometrium. Some has tough muscle layer jutting in. Polyps can occur in almost any part of the body. Colon, gallbladder, vocal cord, urinary bladder, each has different treatment methods. Here we talk about uterine polyps. What age do uterine polyps appear? They are most common in women aged 40 to 74, but younger women are increasingly being diagnosed with them. Often, polyps are detected during an ultrasound or when doctors insert a tiny camera into the uterus for a hysteroscopy. Hysteroscopy is most commonly done to check abnormal vaginal bleeding. Are polyps always cancerous? No need to panic. The vast majority of uterine polyps are benign. Only about 3 in every 100 turn out to be cancer. However, after 40, polyps tend to present more complications. They can appear both before and after menopause. Postmenopausal polyps warrant extra scrutiny because after menopause, we do not expect any growth activities within the gynecological organs at all. What symptoms should raise suspicion? If you experience irregular bleeding, disrupted period, spotting between cycles, heavy menstrual flow, or postmenopausal bleeding, it's worth investigating. Even watery discharge or bleeding with a faint, fishy smell should not be ignored. Polyps might be lurking. Some polyps may stay silent without symptoms. Uterine polyps may be tiny, but they are not to be underestimated. Keeping an eye on symptoms and seeking timely medical advice can make all the difference. When should you see a doctor? Just because you visit a doctor with symptoms of polyp does not necessarily mean you will be diagnosed with them. However, it is always wise to stay cautious. Here are 3 key instances where you absolutely must consult a doctor without losing time. 1. If your menstrual bleeding pattern starts to change. Every woman has a unique menstrual pattern. If you notice any changes in yours, you will likely pick up on them straight away. If anything seems off, don't hesitate. Get checked. Number 2. Bleeding after menopause. Any postmenopausal bleeding, even if it is just a tiny drop or a fleeting instance, should be taken seriously, no matter how minor. Book an appointment within 2 or 3 working days to have it assessed. 3. Persistent discharge that does not improve with medication. If vaginal discharge lingers despite treatment, it's important to check for polyps in the uterus or cervix in the background. How is a polyp diagnosed? Polyps are usually detected via an ultrasound scan. Transvaginal or internal ultrasound tends to be more precise than regular abdominal ultrasound, making it more effective in spotting polyps. However, not all polyps are visible on ultrasound scan. Some polyps vary in type. Some may be missed even with a TVS scan. If suspicion remains high, hysteroscopy is recommended. In certain cases, saline infusion sonography or SIS is also performed. Additionally, some diagnoses are done using 3D TVS, which has greater accuracy compared to traditional ultrasounds. That said, even this method isn't foolproof. Plus, 3D ultrasound machines can be quite costly and are not widely available. If an ultrasound report suggests polyp, doctors may need to visually inspect the uterus using a hysteroscope, a small camera that provides a direct view of the uterine lining. Hysteroscopy is not a surgery. This procedure is done through the birth canal under mild anesthesia, allowing the patient to return home the same day in most cases. We also have a dedicated video explaining hysteroscopy and how polyps appear real life during the procedure. Check the link below. Nowadays, office hysteroscopy provides an alternative where no anesthesia is required. Since many Indian insurance companies are slow to approve claims for hysteroscopy, office hysteroscopy and advanced hysteroscopies have not gained widespread popularity in India yet. That said, hysteroscopy remains the gold standard for polyp diagnosis, offering a direct view of the uterus for the most accurate results. Accurate diagnosis requires a biopsy. If a polyp is diagnosed, it must be removed and examined under a microscope. This procedure is known as endometrial biopsy or histology examination. How many types of polyps are there? Polyps can vary in number, location, and structure. You might have a single polyp or multiple ones. If there is a polyp in the uterus, it's important to check whether there are others in cervix or vagina. Experienced gynecologists often say if there is one, there might be more elsewhere. Some polyps are tiny, just a few millimeters, while others can grow large enough to push through the cervix into the vagina. Such polyps cause persistent and incessant bleeding. Polyps are categorized as pedunculated or sessile. Pedunculated polyps have a thin stalk, making them easier to remove via hysteroscopy. Sessile polyps, on the other hand, has a broad base and can be more stubborn. Some don't fully detach in a single hysteroscopic surgery, while others are so deeply rooted that removal carries a higher risk of bleeding, sometimes requiring a hysterectomy at the end. Treatment options. Most polyps are harmless, but if symptoms start appearing, they are usually removed. Leaving polyps untreated increases the risk of future complications. About 13 of every 100 may develop into precancer or cancerous growths. Small symptom-free polyps can often be monitored instead of being removed. In many cases, patients and doctors opt for hysteroscopic polyp removal to eliminate the uncertainty. Previously, even minor polyps led to hysterectomy. That means uterus removal surgery. Fortunately, advances in medical science now allow us to remove polyps via hysteroscopic resection, avoiding the need for a full hysterectomy. But the story does not end there. A biopsy is essential after polyp removal. The results will fall into one of these three categories: benign or harmless, precancer, which can develop into cancer in future, and cancerous, requiring urgent medical intervention. If the biopsy indicates precancer or cancer, the patient and doctors will discuss the uterus removal surgery as a potential next step. Keep in mind, polyps can return. Studies suggest recurrence rates range from 3% to 60%, so follow-ups are crucial in most cases. Science has not quite cracked the exact cause of polyps yet. However, they are generally more common after the age of 40. That said, younger individuals can develop polyps too, especially those who are overweight, have high blood pressure, or have undergone hormonal therapies. The life-saving breast cancer drug Tamoxifen can also contribute to the formation of uterine polyps in treated breast cancer patients. Numbers are quite high. Up to 1 in 3 tamoxifen-treated women will develop polyp in uterus in their lifetime. Don't be anxious though. Tamoxifen is just life-saving for breast cancer. Only 1 in 10 will eventually turn to be uterine cancer. If in doubt, just get a TVS ultrasound scan done. How can you prevent polyps? Staying active and maintaining a healthy weight can help keep polyps at bay. Avoid dietary hormones intake and be aware of environmental hormone or EDCs entering into your body. We will publish an article on secret dietary and environmental hormones and how to stay away from them here very soon. Keep subscribed if you wish to stay ahead. If you experience abnormal bleeding, report it to your doctor as soon as possible. Remember, most polyps are benign, that means non-cancerous, but symptoms should never be ignored or dismissed. Polyps and pregnancy. Many polyps are detected during pre-pregnancy investigations. Removing them before trying to conceive can significantly increase the chances of a successful pregnancy if the problem was because of the polyp. If a polyp is removed and biopsy results are favorable, there is no reason why you cannot try for pregnancy. Important points about polyp treatment. 4 key insights. Before hysteroscopy became widely available, many patients were often recommended dilatation at curettage or DNC as a standard procedure. That approach is now outdated, and if a polyp is suspected, hysteroscopy is the best course of action for long-term health. If a polyp biopsy reveals cancer, treatment follows standard protocols. However, if endometrial hyperplasia is detected, even though it is not cancer, it absolutely requires a separate treatment. Hyperplasia is considered precancerous. Check out our article on endometrial hyperplasia for more insights. Polyps are commonly seen in women aged 40 to 74, but lately there has been a noticeable rise in cases amongst young women as well. Polyps may not always show up on ultrasound, but they are often spotted during hysteroscopy, when a tiny camera is used to directly examine the inside of the uterus. Health is wealth, so stay informed is the key. Let me know if you would like more details on polyp. Write on the comment section below and I will try to answer. That's all. See you soon with another research article.